students today?
Hi, Miss Wilson.
How are you doing?
Today?
Okay.
Good. My name is Rachel. I'll be your nurse today. I'm with the P&W nursing program. So I'm just going to draw this information.
Thank you so much.
And today I saw that you have in your chart that we're going to be putting the catheter in today. Before we start, I'm just going to check your name and your date of birth on your ID band. Alright, very good. Alright. Now before we start, are you allergic to any iodine, latex? No? Okay. Now, if you would be allergic to iodine, you would be using hydrogen peroxide for the procedure instead of iodine, but since you're not allergic to iodine, we'll be using that. Now, before we start, do you have to use the bathroom at all? Just keep going. Do you have to use the bathroom at all?
I'm going to begin with perineal care before I begin inserting the catheter.
And then would you like
So I'm just going to assemble my equipment on the side. I'm going to put on the
Okay, we'll be
gloves.
starting with the
I'm
period
going to take
today.
the knife, take it over you, undrape you, take off the drape, and I'm going to perform perineal care. And since I am right-handed, I'm going to be on the right side of you.
Okay. And I'm just going to lift this up. Move this over. And now I warmed up the washcloths beforehand, so they should be warm. But let me know if it
Okay, so
feels
I have
cold
two
at all,
water.
okay?
I have two basins, one with sanitized water. The other one with just warm water.
Legs up.
So before I begin, I'm going to place a chucks under you.
And
So if I ask that you just turn around and lift up.
and then one in the middle.
I'm going to
Alright.
take the bathroom.
Now I can put this away. And you already had a waterproof pad down, but if you didn't have one, we would make sure you have one down. I'm just going to put another one down for you when we do the procedure, okay? Lift it up.
Now I'm going to begin with washing.
Alright.
Manual care.
I'm going to take off my gloves and hygiene. And I'm going to set up my sterile field. If you're not doing okay at any time, if you're in any discomfort, let me know, Miss Wilson. Okay. Throw that away.
Then I'll throw this away. And then I'm going to grab just another cloth with warm water to rinse you.
I'm going to start by putting on my sterile gloves. This catheter is going to drain your urine when we put it in.
Okay. And then I'm going to dry
If
it
that's
out really
okay
quick.
with you.
Okay, now I'll just
This
close
is
with my
completely
two basins of
sterile.
water. Then I'm going to remove my soiled gloves. Hygiene. Okay, Ms. Lawrence, now we're going to begin with insertion.
You still doing okay, Miss Wilson? Okay. I'm gonna
I'm just going to set up my
throw that away.
sterile
Alright, I'm going to take this, I'm going to inflate it. Now if you could lift up your butt for me.
Now I'm going to down some sterile gloves.
If you can't, we're just gonna shove her in. Good job. I'm going to take my other, your rapey drape, shiny side down. I'm going to go between your legs, making sure we're not touching either. Now we're going to take our cut drape. We're going to go right there, so we only expose what we have to. You still doing okay? All right. Take this, that there. I'm gonna fluff my cotton balls. Easy to separate.
Then I'll dispose of this.
catheter
I mean,
flow.
like dispose of it.
I'm gonna set that there.
Yeah, and this is the fine straight
Okay,
drape that we
now
won't be
you said
needing.
that you weren't
Place this
allergic
off
to
the side.
iodine, so we won't be using the hydrogen peroxide
And then I'm
today.
going to grab the first drape
So I'm going to
with the shiny
cover
side
these with my
down.
iodine.
I'm going to cover my fingers.
I'm going to take
Okay,
my
then
lubricant,
you
I'm going to
lift
put
up
it
your
in
butt,
here.
your hips.
I'm going to attach my port to my syringe. Right here.
Do the same with this. Other drape.
Okay. Now I'm going to uncover this.
And then I put this here.
Woo.
And
That.
I'm going to just remove all
Right there. I already have my lube in here, so I'm going to lubricate that. Okay, and now we're gonna start. I'm going to clean right here. So I'm gonna take one of my cotton balls, one down, dispose.
So we'll be using the hydrogen peroxide today.
Down,
Then I
down,
dip that.
one,
This is here.
down.
We will need hydrogen peroxide.
And I'm going to touch you now.
Solution.
One down.
And then this is if you were to
Okay,
collect a urinary
so we already have this
specimen,
lubricated.
collect a urinary specimen. And
So
after
now,
this procedure,
I would like for you to take a deep breath. The catheter is going to go in, okay?
we're going to
Alright, good job. Good job, good job. I'll go about 2 to 3 inches until I see the return of urine. And now I'm going to keep going another 2 to 3 inches, making sure that if I'm at resistance, I return it. Alright, take this out of the container. I'm going to inflate my balloon. Good job, good job, good job. Take that off so it can't reflate. I would be discarding this, so we're gonna say I discarded this. I would also cap it maybe. All right. Now I'm going to tug and make sure I meet that the balloon is inflated. Okay, and now holding this still. I'm gonna say you're good. Now if I would need a urine specimen, I would clean this port and I would remove a urine specimen. We already saw that the bag was closed. You still doing it okay? Alright, very good. Now I'm going to put this over here for now, so that when we need to attach it, we can. I'm going to place this here. I'd wrap it up and dispose of it. Disposing, I'm disposing, I'm disposing. Take this out. Disposing of it. I'm not putting it back to use it again. Alright, I'm going to take my gloves off. Disposing. Okay. Now, at this point, do you need any peri-care while the catheter is inserted? If you would like some, we would do some, so I would be doing that. Got hand hygiene. Gotta put on some gloves to attach your catheter with the little band I got here.
Then I keep inserting
And we saw before that your bag is
until I
closed.
see some urine flow.
You still doing
And when I
okay?
see some urine
Everything
flow,
feel
I'll
alright?
insert another 2 to 3 inches.
It's a little uncomfortable, and if you
And
had
if
needed
I
some, we would give you some
need
anesthetic
I'll have the patient
gel.
take
We
deep
would be
breaths,
lubricating
and
with
I'll
that for
rotate
you if you had needed it, but you didn't. Good thing. Okay, now I'm going to take this, making sure this is down here. Going to tie this around. And I'm going to attach it with this little Velcro-y spot over here. And I'm going to take this, loop it through, like that. Everything feel okay? Alright, good job. You can put your legs back to normal. I would move that, but... And now I'm going to attach this, making sure it's closed, to the bed.
Do that, and then I'll to see if the resistance. No, I'll hold it to that. Once I complete
I'm going
it,
to put this up, cover you up.
and I'll cut the resistance.
And I'm going to lower your bed. I'm going to lower your bed. Okay, the bed is lowered. The bed is in the low position. All this stuff is in here. Is there anything else I can do for you? The call is in place. Thank you, Miss Wilson. Bye.
After that,
Okay, now I'm leaving.
I'm going to
Hi, Miss Wilson. How are you doing today? My name is Rachel. I'm your student nurse today. I'm with the P&W nursing program. I'm going to be taking out the catheter. Now, before we start, I'm just going to verify your name and your date of birth. All right, and we did receive an order for your catheter to be removed. We didn't. We wouldn't remove it. Now, before we start, do you need any peri-care at all?
Okay, so then I'm going
No?
to
Okay.
then I'll lower the bed, and once the bed is all lowered, I'll attach the bag to the
Miss Wilson,
underneath
are you
the
allergic
bed,
to
make sure it's
anything
not
like latex or
creating,
iodine?
side railings,
No?
anything
Okay.
like that. And then I'll perform hygiene.
Put this down. I would be raising the bed, but because it went lower, it's already raised. So, but raise the bed, making sure you're doing okay.
Okay.
I have my
And then
supplies.
I
You're
have checked the
ready to
physical
go.
record for any limitations
Okay,
to physical
how are
activity,
you?
and I have checked the medical order for urinary
I'm going to put my
removal.
chuck down.
I've
So that
gathered
when we
my
empty it,
equipment.
if anything
and
spills, you catch it.
There's no
You
need
don't want
to
the
repeat.
janitor to have to do stuff.
I'm Ms. Flores,
Going to
I'll be your P&W nurse today.
Take this off. I will be emptying it, looking for color, amount, and odor.
Thank you. So I'm here to remove
Palette
your
that's
urinary
out.
catheter because you no longer need
You're
it.
gonna
In order for
safely
you,
set that aside. It would be covered.
to
If you
be
need
more
any
effective
peri-care, we
again,
provide it.
do you have any
I'm going to
allergies?
take this off of the bed.
Okay. Now I'm going to just put on some
I'm
gloves
going
really quick.
to
Actually, I put on some gloves.
unstrap
Put on some gloves
this.
really quick. No, I need to do it because then I'm not going to stick over it. I'm going to put on some gloves. And then I'm going to grab a chuck and place it underneath.
I might not see it.
Oh, wait, that's not your chuck.
Okay.
And then I'm
Going
going
to
to grab
remove
a
that.
chuck. And I'm going to
I'm
place
going
it
to drain your balloon.
underneath the catheter bag, and then with my
Making
graduated
sure
cylinder, I'm
that
going
I am
to
not
open
pulling
up
on it.
the drainage
It's
bag
below,
and
so
drain
it'll
out
just
all your
fill up
urine.
by itself.
Pee, 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 pee. Great, thank you.
Everything's coming out.
Great.
You doing
Then
okay,
with the
Miss
graduating
Wilson?
cylinder, I will
Good job.
monitor or assess the color.
We already have a chuck pad, but if you didn't, we'd put it
And
underneath.
the graduated cylinder,
Just so you
as
know.
well as the clarity. Then I'm going to place this off to the side.
Okay, we're draining, we're draining, we're
Then
draining.
I'm going to
we're
grab my.
draining.
We gotta remove it first. Go with the same gloves. Okay. And then
Think
I'm going
it's
to just
still
remove
draining.
the catheter from your side.
Okay. Gonna uncap this.
Okay.
Throw her
And
away.
then I'm going to use my syringe.
Okay.
Attach it to the inflation
This might be a little uncomforting, uncomfortable, but I'd like for you to take a
Suck out all
deep
the
breath.
water from the balloons that give you
We're
urethra.
just gonna
Your bladder, I'm sorry,
remove,
and fill up the
making
syringe.
sure to wind this
I
up.
documented 10 milliliters.
Throw
going
her
into
away.
The balloon, so there should be 10 milliliters.
That's her away. Going to
I wait for that
remove
to finish.
chuck pad,
Okay, so I'm much
lift up,
finished.
remove.
I'm going to.
I would also wrap this up
Where's
and
the
we're
catheter?
gonna
In the
discard
floor.
it.
Are you ready? I'm going
And
to
if you
remove
needed
it.
any
Should I
peri-care
be
at this
on?
point,
Yeah,
I would also be
please.
providing it.
Then you take a
But you
deep
don't.
breath, and then I'm going to pour it out.
Or if you did, I would
Deep
provide it.
breath.
Then move your legs down to that position. Cover you up. Still doing okay, Miss Wilson?
Lauren,
I'm going to lower the bed.
this. I think that's
Lower the bed.
dispose of it in the chugs. Then I'll remove my
Okay, stop. This is lower. The bed is in the low position.
I'll remove that.
The wheels
and then
are
I'll
locked.
remove my gloves.
The call light is in place. Is there anything else I can do for you, Miss Wilson?
Hygiene.
Thank you. I can go. Okay.
Yeah.
Hi, Mr. Wilson. How are you today? I'm good. My name is Rachel. I'm a nursing student with P&W, and I'm here today to put in a catheter in you. So let me draw the curtain photography first. Let me start by asking for your name and your date of birth. All right, I'm going to check it on your band. Okay. Now before we start, are you allergic to iodine or latex? Okay. No, you're not. So if you were, we would be using hydrogen peroxide instead of the iodine today, but we'll be using the iodine. Now before we start, do you have to use the bathroom at all or anything? No? Okay. And would you like peri-care? Okay. So I'm going to start with your peri-care. I've already warmed up your washcloths. I'd also be using a bath towel if we needed it, but we don't. Cover you there, sir. Lift up down a little bit. I'm going to be placing your shower pad underneath. So if you could lift up your legs. Thank you. Have you kind of spread them a little bit. Okay. Now, like I said before, I have your warm washcloth ready. And I'm going to be taking care that I'm not going to be using the same side for all this. So I'm going to around and go down. Around and down. Down the shaft. Top. Underneath. Okay. I'm going to move that away. Now before we start, do you have to use the bathroom or anything? Oh, okay. Now what this catheter is going to do is this is going to drain the urine from your bladder. Okay. So I'm going to start by setting up my sterile field as if I hadn't used it before. Hand hygiene. I'm going to put on my sterile gloves. Are you still doing okay, Mr. Wilson? Okay. Make sure I don't turn my back on my sterile field. Okay. Okay. So now I'm going to throw that away. And I'm going to begin by setting this up. I'm going to put the first drape down in between your legs, shiny side down. Good job. I'm going to take my second drape. Tighten this up a little bit. Okay, now I'm going to airplane this so you can get underneath your butt cheeks. Could you please lift your hips for me? Thank you. Making sure I don't touch your buttocks with my gloves. And now we're going to take this drape. It's got a little cut in it. We're going to place it over your penis. Okay, good job. Okay. I'm going to do this. Now we don't need hydrogen peroxide because we're not allergic to iodine, so we'll just... I'm going to fluff my cotton balls, so just so they don't stick together. I'm going to take my iodine. I'm going to pour it all over. You still doing okay, Mr. Wilson? Okay. Put the lubricant in there. And I'm going to take this, remove this part. Whoa. Okay. The bag is closed, by the way. I'm going to uncap this.
And then I would also take the ones again.
Those cotton balls did not go out. Okay.
I would turn the oxygen off.
Now I'm going to lubricate 5 to 7 inches. And if you would need an anesthetic gel, we would be using that, but you don't. Now, what I'm going to do is I'm going to touch your penis. I'm touching it, okay? This has iodine all over it. We're gonna swirl around and discard. Swirl around and discard. Swirl around and discard. Swirl around and discard. Okay. This is gonna be a little bit uncomfortable, so I want you to take a deep breath. And we're gonna go in. Good job, good job, good job. 5 to 7. I see a little urine came out. I'm gonna keep inserting, and if I would meet resistance, we just be twisting. All right. Move this over here. Going to inflate my balloon. Good job, good job, good job. Uncap this so it can't come back. And I'm gonna tug on this. Let's see if I see resistance that we know is in the right place. If I would need a urine sample, I would clean the port and collect a urine sample. Now, I'm going to discard of this. Oh! Discard. Okay, now I'm going to remove my gloves. Making sure actually not to do it so I don't think anything. Okay. Now I'm going to hand hygiene. Put on some new gloves. Do you need care? Now if you did, while the catheter is in, I'll take my warm washcloth and put it on. Now I'm going to attach your catheter to your thigh. So I'm just going to have you put this underneath. We're going to fasten this. Oh, we're going to fasten it. I'm going to put this like here, so, and then loop this underneath and put that there. I'm going to attach this to here, to the bed. Are you still doing okay? Are you in pain or anything? No? Okay. So I take the chuck pad out, throw her away. You can put your legs down. Everything feel okay? Okay. Good job, Mr. Wilson. You did very well. I'm gonna put this up. I'm gonna lower your bed. I'm gonna pretend I'm gonna lower the bed, but let's say I actually did. And the call light is in place. The bed is in the low position. The wheels are locked. Is there anything else I can do for you today, Mr. Wilson? Okay. Okay, so now I'm gonna clean everything. Hi, Mr. Wilson. How are you today? I'm good. My name is Rachel. I'm going to be your nurse today. I'm from PW. And I'm here to take out your catheter. Now, already saw in your chart that you have been ordered to take out the catheter. If I didn't see that, we wouldn't be taking it out. I'm raising the bed. I'm gonna check your name and your date of birth. Very good. Now, before we start, are you allergic to anything like latex or iodine? No? Okay. I'm going to uncover you. Before we start, do you need any period care? No? Okay. I'm just gonna over you here. I have a waterproof pad in case anything spills. I'm going to take my syringe, which is somewhere here. Give me a second. Take your syringe. And I'm going to put it here so I can use it later. I'm going to take the chuck that I have, put it underneath so we can empty out your little urine bag. Got my container. I would, and I would be looking for amount, color, and odor. And I'm going to take this off the bed. Now that it's empty, put that wherever it needs to go. I'm going to take this, unfasten this. You still doing okay, Mr. Wilson? Good job. Now I would take my syringe that I had to find. I would already have. I'm going to ask you to take that, turn this off your leg. Okay. Just put that over there. Going to let gravity do the work for me. I'm not going to pull on it. Put this here. We're going to let it drain with a check path there. Okay. You still doing okay? Good.
Honestly, it's a lot wider than my face.
Letting it drain by itself. When we're done with this, would you like pericare? Okay, now if you would, I would give you pericare. Okay, now that everything is drained, I'm going to uncap her, put her over here. Now this part might be a little bit uncomfortable, so hold your breath, hold your breath. Good job. We're gonna take that and throw her away. I'm going to return your legs. Cover this up. You said you didn't want any pericare. I understand. I'm gonna put this cover you back up. You did so good. Is there anything else I can do for you today, Mr. Wilson? The bed is in the low position. The wheels are locked. Collar is in place. Is there anything else I can do for you, Mr. Wilson? No? Okay.